Hi, this is Dr. Ed Schwartz. I had a client email me the other day and said that he smiles excessively and nervously to cover his acne, or essentially to make it so people don't notice his acne. And then he asked, have you ever heard of that, or do you know what I'm talking about? And immediately it reminded me of when I used to really struggle with acne. I used to have a term for this coping mechanism. I used to call it man in motion, like one of the football calls you might hear in the backfield. I used to always stay in motion and always notice that I was staying in motion to not let anyone focus, get a really tight focus on my face and my skin. And when he emailed me and told me about how he excessively smiles and nervously smiles, it reminded me of years of being man in motion. This, quote, man in motion coping mechanism is just one of the many signs that acne patients are just not comfortable in their own skin, in their own body, and really, they're just not comfortable in general. If you can't sit peacefully and look someone in the eye and peacefully have a conversation with them and just relax and breathe deep, let them look at you and let them take you in and then you take them in, it's going to be difficult for you to have any type of intimate relationships, even intimate in a way that work relationships. And when I mean intimate as in a bond, or either a friendship or a work relationship, and of course romantically intimate as well. It's hard to create intimacy when you're constantly in motion, or when you're anxious, or when you're just not comfortable in your own skin. So for today's video, I want you to ask yourself, are you able to sit peacefully and allow people to gaze at your face? And if not, what type of effect is that having on your relationships, both romantically, work-wise, and friendship-wise? If you're still struggling with this, my first recommendation is to first get totally inactive. Even if you have some marks or scars, it's the oily activity or the bumpy activity that really can generate a nervousness that is really not tolerated by one's nervous system. And it tends to make us very anxious, and it can keep us in motion. This kind of twitchy, nervous, non-peaceful way of being. I know all about these coping mechanisms. I lived with a persistent, mild, moderate case for a long, long time, and I was never comfortable in my own skin. And when you go a decade to 2 decades not comfortable in your own skin, and then you finally get comfortable in your own skin, it really is a big deal. It's such a big deal that I've now devoted my whole life to bringing this level of inactivation to everyone. Especially since my doctors failed me, I figured now that I'm able to do it, I'll bring it to everyone. And that's what we're doing here. And this man in motion coping mechanism, as well as many other nervous tics and coping mechanisms, this can all be a thing of the past. It does take some work, it does take some focus, and that's why I call it boot camp. You really have to dig in and transform and really take over your skin and take over your life. So today's video, I just wanted to tell you that I understand these nervous habits, I understand these nervous tics, I understand what this is all about. When you get total inactivation, and for several weeks at a time, several months, you'll find yourself in a more peaceful place. You'll let people gaze upon you, and you'll be able to have more intimate relationships, both friendly intimate relationships and romantic intimate relationships. In both cases, you do have to let people gaze upon you. That's how human beings connect with each other. I'll be here if you guys need me. I'll talk to you soon. Take care.